We can't get away from it. Obviously, what's happening at this moment in time with regards to the coronavirus, and here to tell us more about that is Matt Ashton, who is the Liverpool Director of Public Health. Good afternoon to you, Matt.
Afternoon, Roy. How you doing?
Very good indeed, mate. Tell us about the kind of stuff that you're involved in at the moment. I mean, you have a serious position of authority here that's relating to this, and this is going to be like nothing you've ever experienced before, really, isn't it?
Well, it's true. It's pretty full on at the moment. We're working really hard together across the whole of the system in Merseyside, in Liverpool, to get everybody responding as best we can to this awful pandemic that's going on. And we're doing some really good work. It's just that the virus is really, quite hard, as people will know.
Yeah. What can you tell us that you're seeing on the front line at the moment? I mean, because obviously we get figures and statistics that come through that we see in the national news, but at a local and personal level here, tell us about some of the stuff that you've been seeing.
Well, one of the things we have to work really hard to translate what's happening nationally around PPE guidance, so personal protective equipment guidance, and making sure that people are using PPE as best as they can be locally and that they've got access to that. And this is driven nationally, so we get the national supplies, but we have to make that work locally. And that, I'm sure people will pick up on PPEs really hard. There's been some issues, there's quite a lot of issues around outbreaks in care homes that we're responding to. And obviously we've been tracking the epidemic, trying to understand what the numbers are, understand where it affects our population. Yeah. And I guess that's one of the things for me, Roy, that I'm kind of concerned about the impact of mental health and well-being of our population, both now but longer term, because we know the virus, the pandemic, isn't going away anytime soon. So this affects all of us.
Yeah. Can I just come back to the personal protection equipment? I watched one of the briefings that Matt Hancock did, and he was going on about misuse of PPE. Can you tell me what he means by that?
So there is guidance out from national bodies, from Public Health England, that describes in which situations, in which circumstances, what equipment needs to be used. And I think he was referring to that. The difficulty is that guidance is quite technical, it's quite complicated, but really this is about making sure that our frontline staff, both NHS staff and social care staff, have access to the PPE equipment they need and that they use it when they need to use it. Right.
And in terms of the supply of this, because this has been a real kind of bone of contention at the moment, Rishi Sunak saying the NHS will get whatever they need. Is the PPE there in decent supply now, or is it still lacking?
Well, I think that's the million-dollar question, isn't it? So everywhere, as far as we know, everywhere in the system has got supply of PPE right now, but that doesn't mean that the supply is easy to get hold of. So it's a constant battle to make sure we are getting PPE nationally supplied to us locally and locally to the NHS so that everybody's got it. And I think that's just because of the amount of demand there is in the system, and we support that through the council and through our partners wherever we possibly can. So that can include buying from local providers as well, buying from elsewhere to top up the national supply chains that people are ordering from.
Right. When we see the briefings and we see the medical professionals that's up there, I would imagine you're constantly in communication with people, not necessarily right at the top, but certainly down the kind of line. What is a typical day of communication like for you? Are you constantly getting the updates?
Yeah, so it's very busy, lots of meetings, lots of phone calls. We've become very familiar with the use of things like Zoom and Skype because we're virtually meeting rather than meeting in person. And this is all about us understanding exactly what's going on and enabling us to facilitate that at a local level, so make it real for Merseyside.
Right. For the most part, it seems like people are towing the line, that they are, doing the self-isolation, they're doing the social distancing, and that there's been a few issues, obviously, on the television, but would you say, on the whole, the United Kingdom seems to be behaving itself quite well on this subject?
Yeah, I think so, and certainly from a local perspective, that's the sense I get. I think it's difficult because we are social creatures by nature, aren't we? So to the idea of kind of staying in our homes for a long period of time is challenging for us all, and I think that does have an impact on our mental health and well-being. But there is a very, very important message here that that's what we need to be doing. If we want to be able to get on top of this virus as quickly as we possibly can and try and get life back to normal as quickly as possibly can, then we need to follow those rules around self-isolating if we are ill and making sure we are away from people so we're not infecting anybody else. Yeah. And everybody socially distancing, so staying in our homes and only going out when we absolutely need to. And that's the thing that will have the biggest impact in stopping the spread of the virus and helping us get back to normal as quickly as possible. That's not to say this doesn't have impact, because we know it does.
Yeah. Now, here's the thing, because obviously we know that when the lockdown is not going to be, hey, everything's fine, go back to everyday life. This is going to be a gradually phased in situation, isn't it? Are you in a position where you could tell us what the first phase would look like in terms of trying to restore some kind of normality?
I don't think we can yet, Roy. I think we have to wait to see what emerges nationally, and I think that's where the experts will advise us on what the best course of action will be. Clearly, we want life to get back to normal as quickly as possible, but the most important thing right now is getting on top of the pandemic.
Yeah. Now, here's the thing. You've been talking about what life after coronavirus is going to be like, or life after lockdown would probably be a more appropriate phrase to use here. I feel as though perhaps maybe once it has been the case that, hey, look, the bars are open, the restaurants are open, you are going to have a bit of a chaotic situation, because I think the appetite for people to want to go out and drink, socialise is going to be incredible. That in itself could put a degree of a burden on to the NHS, couldn't it? If people get a little bit kind of carried away with it, couldn't they, post, a lockdown?
Yeah, absolutely. And I think that's why it's really important that these things are thought out nationally, to think through the impact of this stuff when, as you say, lockdown starts to release. It isn't going to be an easy process for any of us. I think what I'd really like to think about collectively is the impact of this on our mental health and well-being, and making sure we are all as well as we possibly can be, because life's changed dramatically, hasn't it? Regardless of whether we've had the illness or not, or whether we're staying at home or whether we're not seeing our friends as much, it's really, really important that we take care of our mental health, so that when we come out of the other side of this, we're in the best possible place individually, but as a society, to get back to normal as quickly as we possibly can.
Now, you're in the business of having to deal with facts, because that is what this is all about, and you will act upon the information that is given to you. That's the way things are going to be. What is it like from your point of view when you come across stories on social media where there's unfounded suggestions, conspiracy theories, all of that kind of stuff? What is it like for you as a medical professional, somebody who's knowing what's going on at the moment? What is it like when you come across stuff like that?
Well, it's difficult. I think we all understand that as people, we don't like not having information, and sometimes we create information to fill that gap. But it's really difficult, and I think that my overriding message here would be: there's no big conspiracy around this. This is about how we as a country and as a society, and certainly in Merseyside, how we deal with the pandemic as quickly as possible and try and get life back to normal as quickly as possible, whilst protecting the lives and the well-being of as many people as we possibly can. So I think that I've seen some of these messages around, drinking water and the 5G masts and all that kind of stuff, but frankly, I think that's a bit of a distraction, and we just need to stick to the core messages that we've got.
So there could be a danger, really. I mean, social media, as much as it is probably providing a lifeline to an awful lot of people, there is a degree and elements of people that use it which are causing a problem. And I was thinking about these things, because obviously you've got a lot of time to think about it at the moment. That's social media. What would life have been like if you'd have gone back to the 1980s when AIDS first came on the scene? Now, obviously, very different kind of thing. I know they're both a virus, but of course, it was a real unknown thing back in the day, and AIDS was killing people, regardless of what your sexual orientation was. And I'm just wondering what life would have been like back then had there have been social media. Would it have been worse than things are now, do you think?
So I think that the common denominator is probably the need for us to all use trusted sources of information.
Yes.
So back in the 80s, as you quite rightly point out, we had large-scale health information campaigns talking about the risks of AIDS and of HIV, and we don't have those as much these days, but we do have social media, and we do have websites where we have official bodies putting out the key messages. And so I think that's the point for me, is we need to make sure we use those trusted sources of information, so local authority websites, the NHS websites, and so on.
Yeah, we had a education correspondent that was on the other day, a contributor, Les Stewart, and we were talking about perhaps maybe how possibly the way the world or the way our children are educated could be something that would feature off the back of this. And I'm sure that you would welcome within schools if we could go down the route of doing what you've just said there, identifying the trusted sources. I mean, the first thing from my point of view is if something comes up that has got a spectacular headline, the first thing I do is, where does it come from? I mean, has it come from, a reputable news source, or has it come from some word-pressing blogger or something like that? And I think that if you brought that into the school environments, educated people so that they can smell the difference between truth and non-truth, that would be a good thing and would probably make life easier for you guys, wouldn't it?
Oh, absolutely. And I think, to be fair, a lot of schools already teach their pupils some of that already. So I know my daughter's had some of those lessons around how do you distinguish between right and wrong information. I think there's probably a chunk of us in the middle that are missing. So people who've grown up as this technology and as websites have developed, we probably haven't automatically had that training. I think health professionals certainly have that as part of their professional training, trying to understand the difference between false information and real information. But you're absolutely right that this needs to be something that everybody understands and can challenge appropriately. But there are really, really good websites out there already. So, for example, around the mental health and well-being work that we're trying to talk about at the moment, there's a great website which listeners can access, which is kindtoyourmind.org, www.kindtoyourmind.org, and that's got loads of resources on there around how people can help stay mentally healthy and well during the pandemic. So I'd really urge people to go and have a look at that. And I can describe some of the content that's on there as well if you want me to. Yeah, sure.
Fire away, yeah.
So I think the difficulty is for all of us, and I'm sure we're all in a similar position where we're at home a lot more and the news is on 24 hours a day talking about coronavirus. It's really quite common to feel, I guess, worried or scared or helpless about the situation. But it's okay for us to be able to talk about these things, and if we don't, I guess we're at more risk of doing ourselves some harm. So accessing some of the NHS resources and the kindtoyourmind.org website I've just mentioned, there's loads of great trusted information on there. So there's three big pieces of information. The first one is called Alma, which shows all the different apps that you can get on your phone that help you around mental health and well-being. It's really, really good. The second bit is access to the Every Mind Matters website, which is an NHS website, and that gives tips, advice and support for how we can stay mentally well. There's a part on there that I really like, which is around how we look after our children and young people during that. So it's given me some tips for how I talk to my daughters about how they're feeling right at the moment. And then the third bit, and crucially for some of us, is where do we go to access support if we're having a mental health crisis? And that third part of the website lists all the helplines that are available across Cheshire and Merseyside for anybody who's in need of urgent support around their mental health. It's a really, really good website, and I think we spend a lot of time talking about physical health. We spend a lot of time talking about the direct impact of the virus, but I think the thing we need to not forget about is the mental health impact on all of us. Yeah,
and that is the big thing, obviously, coming out of it and during it as well, obviously keeping on top of it. And if you are listening, the kindtoyourmind.org.uk is that website.
It's just .org, Roy, sorry.
.org.
kindtoyourmind.org.
Okay, yeah, and of course, the campaign started on Monday. You're going to be running this for 6 weeks.
We are, and really wanting everybody to get involved in it as much as they can. So we've just talked about social media and some of the risks of social media, but actually if we start to reclaim this a little bit, if people use the hashtag #BeKindToYourMind and upload their comments, their thoughts, their videos about how they are staying mentally well, we can use that to support the whole of our communities across Cheshire and Merseyside, which is absolutely what we need to be doing right now, isn't it?
Yeah, well,
looking out for each other and being kind to each other.
A little video goes a long way, and it's one of those things that it might be such a simple thing. It might not be everybody's cup of tea, but if it resonated with a couple of people who could look at what was going on there, apply it to their lives, then it's a video worth making, isn't it?
Absolutely, yeah.
Yeah. All right, mate, just remind us again, people want to find out more about the campaign, how they can do that, if you would, please, Matt.
Yeah, so go to the website, www.kindtoyourmind.org, to access help across those three areas. But most of all, just make sure people, if you can all think about your mental health and well-being and look after each other as well as you possibly can do, that'd be fab.
That is the big thing. Great, mate. Listen, thanks very much indeed for spending a little bit of time with us on the show today.
Cheers, Roy.
Okay, that's Matt Ashton, the Director of Public Health here at Liverpool. And it's a tremendous organisation there and a tremendous initiative that they're putting together, because this is the thing that we've spoken, it's one of the areas that is covered quite extensively here on Liverpool Live, that of mental health and mental well-being. Of course, knowing that you've got somebody to speak to, knowing that there is a resource for information that you can use will make a big difference to you. So do take advantage of it. Definitely get in touch and check out the website that we've just been talking about there, which is, reminding myself, kindtoyourmind.org. All right, it's coming up to 1 o'clock. Catman's got the news and sports headlines. Following up next.